Chapter 5. The Unlearned Lesson: Sabotaging Our Shields Before the Next War. Introduction: Repeating the prelude to a tragedy. The greatest tragedy is not making a mistake, but consciously repeating it after witnessing its catastrophic consequences. The United States is doing precisely that. The systematic dismantling of the nation's public health infrastructure that began in the previous Trump administration is not being reversed. It is being accelerated and codified into law, despite the stark lesson of over 1.1 million American deaths from COVID-19. The pre-2020 playbook, defunding preparedness, sidelining scientists, and championing ideology over evidence, is being reenacted with greater speed and severity. This chapter documents how the calculated erosion of agencies like the CDC and NIH, the promotion of anti-science rhetoric to policy, and the abandonment of global health leadership are not just political maneuvers. They are active choices that guarantee a more devastating outcome when the next inevitable pathogen emerges. Section 1. The Unwinding: Dismantling the System by the Numbers. The architecture of American public health is being deliberately taken apart. The following data points are not projections. They are recent, concrete actions and their immediate consequences. 1. The personnel. Exodus, a brain drain of expertise. The nation's health defense relies on experienced scientists, epidemiologists, and outbreak specialists. They are now leaving in droves. Morale and attrition. A 2023 CDC survey found that nearly 40% of its public health workers reported symptoms of PTSD and are considering leaving the field. This quiet quitting is as damaging as formal cuts. Targeted defunding. The proposed FY 2025 budget from the Republican Study Committee, which represents 100% of House GOP leadership, calls for drastic cuts, including eliminating the Agency for Healthcare Research and Quality and slashing CDC funding. This creates uncertainty that drives experts into other sectors. Local collapse. Since the peak of the pandemic, an estimated 130,000 local and state public health jobs have been lost, decimating the frontline forces needed for everything from restaurant inspections to measles contact tracing. 2. The legislative assault: codifying vulnerability. Policy is being used to permanently disable public health tools. Curbing authority. As of May 2024, over 40 states have passed laws limiting the authority of public health officials to mandate masks, vaccines, or quarantine measures. These laws handcuff officials before the next crisis even begins. Health freedom as policy. Legislation like Florida's 2023 Ethical Distribution of Vaccines law, which explicitly forbids businesses from requiring vaccination proof, creates a patchwork of vulnerability where viruses can thrive and cross state lines unimpeded. Defunding prevention. The ongoing political battles over PEPFAR, the President's Emergency Plan for AIDS Relief, a program that has saved 25 million lives and serves as a cornerstone of global health security, demonstrate a willingness to sacrifice proven health programs for ideological points. 3. The institutionalization of mistrust. Perhaps the most damaging cut is to credibility itself. Erosion of trust. According to a 2024 Pew Research Center report, only 44% of U.S. adults now have a great deal or fair amount of confidence in CDC officials to act in the public's best interests, down significantly from pre-pandemic levels. Misinformation inoculated into policy. The appointment of officials like Florida's Surgeon General, Dr. Joseph Ladapo, who has repeatedly questioned the safety of COVID-19 mRNA vaccines without scientific evidence, signals a new era where anti-science views are granted official platforms, further eroding public trust. Section 2. The lessons we are choosing to ignore, again. 1. Preparedness is not an expense, it's an insurance policy. The first lesson from COVID-19 was that underinvesting in preparedness leads to catastrophic spending later. The U.S. spent trillions on economic relief and healthcare costs for a pandemic that a few billion in sustained preparedness funding might have contained. We are now canceling that insurance policy once again. 2. Viruses don't respect borders or ideology. The withdrawal from global health partnerships and the decline in funding for surveillance abroad means we are blinding ourselves to emerging threats. An outbreak in a remote village today can be a pandemic at our doorstep tomorrow. Defunding global health security programs is a direct threat to national security. 3. Trust is a public health utility. A vaccine developed at record speed is useless if a significant portion of the population refuses it. The persistent attacks on scientific institutions and the legitimization of misinformation have degraded this critical infrastructure. Rebuilding it will take decades, time we may not have. Section 3. The inevitable scenarios, from hypothetical to inevitable. 1. The Measles Firestorm, 2024-25. This is not a future scenario. It is already underway. The U.S. has already recorded more measles cases in the first quarter of 2024 than in all of 2023. With kindergarten vaccination rates dipping below the 95% threshold for herd immunity in many communities, the conditions are set for large, sustained outbreaks that will overwhelm the very health departments that have been stripped of their capacity to respond. 2. The avian influenza, H5N1. Test case. The ongoing spread of H5N1 in dairy cattle is a live fire exercise for our crippled system. The response has been criticized as slow and opaque, with concerns about insufficient testing and surveillance. If this virus, with its approximately 50% mortality rate in humans, gains efficient human-to-human transmission, the current infrastructure is not equipped to mount a rapid, effective response. The delays seen now are a preview of a much larger failure. 3. Disease X, the guaranteed catastrophe. The next novel pathogen is a matter of when, not if. When it arrives, it will find a system weaker than the one that failed in 2020. Fewer experts, less coordination, more legal restrictions, and a public deeply divided and distrustful of guidance. The result will be a higher death toll and deeper societal disruption. Conclusion: a preventable future if we choose it. The cuts and policies described are not fiscal austerity, they are arson. They are the deliberate setting of fires within the very systems designed to protect us from conflagration. When the next crisis hits, and it will, the same voices now weakening our defenses will be the first to call the resulting death toll an unforeseen act of nature, or blame the scientists for a slow response. But the autopsy report is already written. The cause of death will be a pre-existing condition, a deliberate policy of neglect, fueled by ideology, and a catastrophic failure to learn from recent history. The story you just heard in this chapter isn't just history, it's a warning. And this warning is not over. The policies, the failures, and the human cost we've documented in unnecessary deaths continue to shape our world right now. If you want to understand what happens next, you need to see the full picture. On this channel, we're not just releasing the audiobook, we're building on it. We'll be diving deeper into the data, tracking the real-world impact of the policies discussed in this book. By subscribing, you're not just getting the next chapter, you're joining a community committed to learning from the past to protect our future. Subscribing is the easiest way to ensure you don't miss a single video. The next chapter drops soon. Here's what you can do right now. Hit the subscribe button. Click that bell icon to get notifications so you know the moment the next chapter is live. Check the links in the description below to get the full ebook on Gumroad and dive deeper at your own pace. The most dangerous lesson we can learn from unnecessary deaths is to look away. Stay informed, stay engaged, and please, subscribe. Thank you for watching and for caring enough to listen.